Hello, everyone. Good evening. I'm Pooja from the Bladder Wellness team, and today we have with us a very well known doctor, Dr. Ankur Bhatnagar from Faridabad. Dr. Ankur has a very rich experience in the field of urology and has performed various critical surgeries and has treated his patients with utmost care. Today, Dr. Ankur will be talking on a very important topic and be shedding light on a lot of important aspects about the condition called overactive bladder. Overactive bladder, also known as OAB, is a condition of the bladder which causes sudden need to urinate that may be difficult to control as well. OAB increases with age and is more prevalent in women than in men. This condition is common and distressing and may have a large impact on the quality of life of the patients. So let us hear more on OAB from Dr. Ankur himself. Dr. Ankur, over to you.
Thank you. See, in a very simple terms, you have already defined overactive bladder. In medical terms, it is a condition which consists of symptoms like urgency, which is usually accompanied by frequency as well as nocturia, which may or may not be associated with urinary incontinence. But before making a diagnosis of overactive bladder, you have to rule out certain conditions like urinary tract infections as well as any other bladder pathology. So once again, I am going to repeat the definition in very simple terms. Overactive bladder consists of a sudden urge to pass urine, which is difficult for the patient to postpone. Patient may have these urges multiple times of a day, especially when we come to a definition, it should be at least more than 8 times. We call it frequency. Then patient may have these urges even at the night. So he may have to wake up in the night, middle of the night, to pass the urine multiple times. And sometimes it is associated with urinary leakage, means when the patient has to urge, means patient has to rush to pass the urine. Before reaching the washroom, he or she may leak the urine. In these cases, it is also known as wet overactive bladder, wet OAB. And in some cases, in those cases in which it is not associated with urine leak, it is also known as dry OAB. So this is the definition which we use as a standard and how we explain it to the patient.
Okay. So, doctor, but what are the symptoms of OAB?
See, when we speak of the symptoms, the definition very well explains in itself that the patient will feel a strong desire to pass urine, which is very difficult for the patient to postpone. It is sometimes so difficult that he or she leaks the urine in the undergarments become wet. So this is called urgency, which is the primary symptom. It is usually associated by a frequency of urination, means patient has to go to washroom multiple times or at least more than 8 times in a day. And otherwise, in these patients, they may also have a urge to pass urine even in the night after they are asleep. So they have to get up from bed from the sleep is disturbed, and they have to go to the toilet multiple times.
Okay.
Patient may have incontinence, means urine leak. They may not have urinary leak. And when we since we are talking about the symptoms and we ask the patient about the other symptoms regarding which may suggest some urinary infection or other pathology, they are not having these symptoms as such.
Okay. So, doctor, I think I just spoke about this condition being more prevalent in women versus men. So, any
Yes.
specific reason why do we see it in women more than men?
It is usually very commonly seen in females. The reasons, the explanation which they mention in the textbook is the uh, since a woman in her lifetime undergoes through various hormonal changes during the monthly periods, during pregnancies, lactations, they are cited as an important cause of these, the presence of overactivity in females, the effect of these hormones. And otherwise, in females, there is a higher incidence of urinary tract infections in the reproductive age group. So, as a sequel of it, we see commonly in our clinical scenario that even though the patient at some point of time is not harboring any infection, but but she may be having some symptoms of overactivity without the presence of infection. So So you can very well attribute it to the hormonal changes that go on in female body, as well as the history of repeated or recurrent infections in the past.
Okay. So and we also read about this increasing with age. So is
Yes.
it is it that it starts with a specific age? If we're looking at females, what age does it really start at? If we can look at it.
In females, it is actually not very specific to age,
Mm-hmm.
because during the reproductive period, when the body is undergoing hormonal changes, it is very commonly seen in young females also, and
Yes.
even after the menopause, the symptoms are seen in females. But in case
Okay.
of males, there is very big difference with related to age, because the majority of overactive bladder condition in in male patients is due to the result of prostatic enlargement. The prostatic enlargement and the resultant bladder changes that occur due to following the resistance that occur due to prostatic enlargement is a major cause of development of overactivity. In males, the prostatic enlargement or the symptoms due to prostatic enlargement are usually seen beyond 55 years of age. So in
Right.
males, it is very less common in the younger age. It is usually seen in elderlies. I'm saying elderlies means over 55 or 60 years of age.
Okay. So does it have any connection between OAB and prostatic cancer? Is there something that, our patients or viewers need to know about the connection between these two?
No, as such, there is no connection between the between overactive bladder and prostatic cancer. But patient usually presents with prostatic symptoms. Even if a patient is a case of benign prostatic enlargement, means non-cancerous prostatic enlargement, or if a patient is a case of cancerous prostatic enlargement, overactive bladder can be a part of the symptomatology. But otherwise, there is no direct correlation that if a person is having overactive bladder symptoms, then he is sure shot to have a cancer. This is not
Right.
as such.
Right. Absolutely, doctor. So I think with women, we understood what could be the causes. You said the hormonal changes, the reproduction. But what about males? What are the causes that could lead to overactive bladder?
See, actually, when with the aging in a male, there is prostatic enlargement, which is part of the natural aging process in males. So, prostate is actually a gland which wraps around the male urethra. Urethra is the passage of the urine that takes urine out from urinary bladder to exit. Okay, so it is a tissue, a gland which wraps around the urethra, and whenever there is enlargement of the prostate, it compresses the urethra and produces obstructed urinary symptoms. So
Okay.
when there is obstruction to urine flow, the bladder wall is gets some changes because of the overactivity it has to do. And during this process, these bladder changes sometimes present as overactivity in males. So overactivity in males is usually seen in elderly.
So what I understand is females could be susceptible to a condition like this in their younger days, but males
Younger days.
usually could have this at an elder age because of the prostate
Yes,
enlargement. Okay.
yes, definitely.
Fair enough. So, doctor, uh, while it doesn't sound as a very, very serious issue, but I can understand it can be very discomforting for anybody who's going through this complete condition. So, what is the treatment like, doctor? So I'm sure it sounds very easy to deal with, but somebody who's going through overactive bladder can only know the discomfort that they're going through, especially for the males who are in their elderly age. So, what is it like that we can look at from a treatment perspective? Yes, doctor. I think you were not able to hear my question.
Yes,
So, we
there
were
was a
looking
breakdown
at
in
the
connection.
Yeah, we were looking at the treatment, doctor. Imagine somebody who has overactive bladder, be it a female or a male. So, what exactly could be the treatment that we can prescribe?
See, before starting a treatment, we have to classify the condition as overactive bladder. So the last
Yeah,
line that I mentioned in the definition was the patient should be free of any urinary tract infection or any otherwise pathology. So
yeah.
we have to rule out infection or other pathology. Then we can label it as a pure overactive bladder. And based on the findings, if the patient is harboring any infection, then you have to give antibiotics to treat the infection and document it treated. if the patient is having any other pathology, like if he's harboring any stone, any bladder tumor, then you have to get rid of that. If these conditions are not present and we are talking purely of overactive bladder, then the management is dependent on two things. First of all, we give some lifestyle modification advices to the patient, and second one comes the pharmacotherapy. Lifestyle modification lifestyle modification that patient has to do are very effective in these cases, because these are basically functional problems. And if the condition is not cured by lifestyle conditions, we may add medications, or they can be used as a complementary to each other.
Okay. So, doctor, what sort of lifestyle changes have been suggested in such scenarios?
See, we give patients some regarding advice regarding some fluid as well as dietary changes. Okay.
Okay.
So
Okay.
when we comes to fluid management, we ask the patient that it's not required to drink a lot of water, as we usually see that we should remain well hydrated, should drink a lot of water. It's not like that. You should drink only water that is required to quench your thirst, so that you
Yeah.
may get a clear urine, not smelly or yellowish, dark yellowish color urine. So liquid intake in an otherwise healthy adult, male or female, is around 1.5 to 2 liters per day. That comes out to be 8 glasses of 250 ml each.
Correct.
Okay. So liquid intake should be around 1.5 to 2 liters. Avoid excessive liquids at night. Avoid caffeinated drinks or beverages at night that have some sort of diuretic effect. So you have to get up at night multiple times to pass urine. Then in diet we follow that you should avoid spicy meals, fried foods, especially at the night, and some irritant items that you take like chilies, that should be avoided. Same comes
Okay.
with beverages. Beverages should be limited. I'm not saying that you have to stop tea and coffee, but you have to limit the consumption to just once or twice a day. Okay, especially at night, it should be avoided, especially in those patients who are already having these symptoms. And other thing is that bladder, so you have to just stop, quit smoking, not stop, quit smoking. Okay. Then there is an importance of weight reduction. Overactivity is very commonly seen in a patient who are overweight. So weight reduction, regular exercises are also advised for these patients. So these are all the lifestyle modification in a nutshell that we advise to our patient, which are easy to understand and simple to grab by the patient.
Okay. So, doctor, you mentioned about no smoking, but what about alcohol consumption?
See, alcohol consumption should be moderated, because not only it's affecting, it may act as a diuretic, you have frequency, it may affect your bladder also, but it's also harming other organs also, liver also is affected. But alcohol is, you should not be just quitting alcohol, you have to moderate the amount. For those who are
Okay.
heavy drinkers, it's always advised to reduce it drastically. But who are occasional drinkers, it's not recommended to stop alcohol as such. Smoking is a
Okay.
different thing, that people are never occasional smokers, they are usually smokers.
Yeah.
So it is advised to quit smoking.
Okay, fair enough, doctor. So, if I have to advise my viewers, for example, adults who are aged 50 or above, experiencing overactive bladder, frequent urination, if they reach out to a doctor, which are the immediate pathology
Yes,
tests that are needed to define that they are, facing this condition?
we're still missing out on your connection, I think.
So I remember you mentioned about one of the urinary tract infection test in XYZ, but which are the complete set of tests that they need to undergo? So, I mean, I understand that somebody who is going through this condition may probably feel that it is not something serious. But how do we really go ahead and define that this is a condition which is overactive bladder? I'm sure there are some tests, like you mentioned about, ensuring that there's no UTI, there's no stone. So, which are those tests that are usually conducted to confirm OAB? I can imagine this condition
I think there was a
could
tiny
be
bit of
really
background
difficult.
noise. So,
No problem, doctor. So, we were just talking about which are the tests that a person needs to undergo to
you,
confirm that he or she has OAB. I know you spoke about UTI and the stone, but anything that you want to elaborate about the number of tests and the kind of tests?
yes. So basically, we don't have to be very comprehensive in testing. Just a urine routine and microscopic examination will give us an idea about whether urinary infection is present or not. Ultrasound of the KOV, kidney, ureter, and bladder will give us an idea about the prostatic size, any bladder conditions, or any urinary retention. And the other thing is the flow test, urinary flow, whether there is some obstruction in the urinary flow that can very well a cause of the changes in the bladder. So I would suggest, I recommend my patient three of the tests: ultrasound KUV with post-void residual urine, uroflowmetry, and a urine routine and microscopic test. In patients who are diabetic or who are suspicious of having a diabetes, I recommend an HbA1c, which is a 3 month average sugar test, to know whether they are diabetic, or if in case of diabetes, if they are having a good sugar control or not.
Okay. So these are simple pathology and lab tests that one can undergo, and they
Yes,
can, really define whether the person's having OAB is at what stage, and
yes,
then of course the treatment can be defined. So, doctor, should we dive into the treatment aspect as well, and explain how can this condition be treated in different patients?
yes, very well. See, like I previously mentioned, the treatment is based on lifestyle modifications as well as pharmacotherapy. So the lifestyle changes, the dietary changes, fluid changes, weight reduction, I have already mentioned. Now, when we come to the pharmacotherapy, definitely you will be visiting a urologist for the advice. There are two category of drugs, like the anticholinergic, antimuscarinics, also known as antimuscarinics, and the other category is the beta 3 agonist drugs. So these drugs are basically given to the patient with overactivity, and sometimes some few medications, other drugs are also added, like in case of prostatic patients, in which the prostatic enlargement is associated, giving some obstructive symptoms associated with overactivity. Then you have to add some alpha blockers also. So primarily for an overactivity condition, we have two class of drugs: anticholinergics and beta 3 agonists. And in case of male patients where the prostatic symptoms are also associated, we can add an alpha blocker with any of the two drugs.
Okay. So, does that treatment really, is it painful, or is it something that my viewers should know of
The-
in terms of the treatment?
These are basically oral medications. You can very well take it. There is no any specificity with related to time. You can take it any time in a day. Usually 1 or 2 tablets a day are more than enough. So compliance is also better. The degree of bother of the symptoms uh, uh, is also very important guide to the dose of the medication. Sometimes we have to combine two or three category of the drugs together to give patient best relief. But
Mhm.
otherwise, on a broad scale, I'm just saying that these are medication which has to be taken only once or twice a day, so the patient compliance is good. He or she can very well take it. There are usually no side effects, means no major side effects, and there are no major interactions with any other medication the patient is already been taken for any heart problem or any kidney problem or any diabetes related problem, anything.
Okay. So, doctor, the line of treatment remains the same, be it a male or a female. Is that
Yes,
how it
yes.
is?
Line of treatment is same. We have to means provide a relaxation therapy to the bladder. So these medications, the anticholinergics as well as beta preagonists, are bladder relaxing agents. So the continuous urge of the flickering in the bladder is controlled. So the symptoms are improved.
Okay. So, doctor, I remember of this condition being faced by one of my friends, especially post her delivery. I remember that she put on like around 8 or 10 kgs or something, post which she started complaining of urine leaks, especially when she was like working out or doing any jumping activities. So, I mean, the doctor just advised her for some Kegels exercise or something, but nothing beyond that in terms of medication. So, in such cases, especially my ladies who are going through this hormonal change or pregnancy, what is that they should be immediately doing to probably prevent OAB or any sort of treatment?
See, there is a difference in the scenario that you have mentioned. Your friend who just had a labor, delivered a baby. So in this condition, the incontinence, yeah, overactivity that she is having is known as stress incontinence. It is not a part of overactive bladder. In
Okay.
stress incontinence, whenever there is a stressful condition, whenever there is a rise in the intra-abdominal pressure, the continent mechanism is overwhelmed by that stress, and patient has a urine leak. So this is altogether a different condition. It is basically related to the muscular weakness, and it is
Yes.
usually, in most of the cases, the primary management is the bladder pelvic floor exercises. So we also known as Kegels exercises are advised. In such cases, the role of pharmacotherapy is limited. Means the pelvic floor muscle training is the best guide, and especially in young females who just had their child, exercises do very well, and the patient is relieved of their symptoms on a long run. In these patients, they may have an associated overactive bladder, but the condition that you are mentioning is a case of stress incontinence. It's not a part of overactive bladder.
Okay. Got it. Fair enough, doctor. So, anything in terms of prevention of this condition, what can be done to prevent OAB,
For you're asking
either
for
male or
stress
female?
incontinence or
No, I'm
overactive
talking about
bladder,
OAB. OAB.
OAB. See, to prevent this condition, the things that I have mentioned, like the lifestyle modifications, see, uh, may or may not be very evident, but as I can be giving the example of yourself or myself, we may also sometimes experience these symptoms. May not be very prolonged, maybe just for some night. When we take beverages, especially multiple tea or coffees at the night, we feel that we have to go and pass urine multiple times. It is a common scenario. It's not that we are developing overactive bladder or we are having overactive bladder, but it's very commonly seen. So the changes that I have advised as a part of treatment of overactive bladder may very well be used part for prevention of development of overactive bladder also.
Okay. Okay.
Okay.
All right. Okay. So, if this was prevention, the treatment, and the causes, anything else, doctor, that you want to highlight about the subject of OAB?
Uh, Not exactly. See, the symptoms may be confusing, may be overlapping, but the best part, well, the best treatment can only be given only if we classify the problem very specifically. Like you said, it should not be confused with stress incontinence. It should not be just uh, means it should not be confused with any other pathology that has been going inside the bladder. So it's very
Mm-hmm.
important to consult a urologist, get these primary investigations that I mentioned, so that there can be very certain, the doctor can be very certain that you are not having any harboring any other pathology in your body inside the bladder. See, and in case of males, especially elderly males, prostatic symptoms are to be taken care of because the obstructive symptoms are more damaging. It can cause a back pressure damage to the kidney also. Overactive bladder as such is not very damaging. It may hamper your life lifestyle, uh, means decrease the quality of life, but they are not very dangerous to your body. But
Yeah.
otherwise, the other diseases that that may mimic as overactive bladder should not be just taken for granted. They should be proper workup for this condition, and the treatment should be given only after proper workup, unless and until you are not sure that these symptoms are not due to any other pathology. You just cannot go blindly and get the treatment, get the tablets, and go on with it.
Right. Doctor, there's a question coming from Raju. Fairly, you've covered this part, but Raju has a question about what role does age play in OAB?
Okay. See, the age related changes that I have already mentioned previously also, I'm just repeating it. In females, the overactivity may be seen in younger age also as well as in older age. In younger age, the major cause is hormonal changes that occur during the periods also, during pregnancy also, during childbirth also. But once the age approaches the menopause, there is sudden dip in the estrogen and the local tissue has lost its youth. So sometimes these drastic changes in the estrogen levels, which occurs during the reproductive as well as in the post-menopausal period, are very important cause of overactivity in females. So in females, the aging factor is due to the hormonal changes majorly. In case of males, there is the aging changes that occurs in the bladder, which may lead to overactivity, are usually caused due to a chronic obstruction which is produced by prostatic gland. So overactivity is very common in aged, be it a male, be it a female. But in younger ages, it is usually seen in females, very less common in males.
Okay. Okay. Another question from Rahul Doctor. He says, what lifestyle factors contribute to OAB?
See, smoking, excessive alcohol drinking, regular means taking very spicy or fried food daily on a daily basis, especially on nights. So these are the things that have the substances which are irritable to the bladder. So there is a continuous flickering in the bladder musculature. There are changes in the bladder that can produce these symptoms. So in these, I'm explaining these things in a very simple terms, that to prevent as well as to treat overactivity, it is very important that you quit smoking, moderate alcohol consumption, reduce weight, do regular exercises, and avoid spicy and fried meals at night, especially.
Okay, Rahul. So I hope you got your answer. Another question, doctor, from Palkesh. He's asking, what are the side effects of OAB medications?
Yes. So the major class of drug, which is the first line treatment, is the anticholinergics. So major side effects of anticholinergics, it produces constipation, dryness of mouth, dryness of throat, dryness of eyes. These
Mm-hmm.
are the side effects that sometimes will lead the patient to discontinue these medications. So another class of drug was developed in recent years, I think 5 to 6 years back, beta 3 agonists, which have almost similar efficacy in controlling overactive bladder symptoms, but the side effect profile is better. But the thing is that the beta 3 agonist may sometimes produce hypertension in those patients who are already having uncontrolled BP. So it should be used very cautiously in these patients. Then coming back to the anticholinergics, especially in the in elderly, if we are going to give a long term treatment, it can have cognitive effects on the patients, means the finer movements, these things can get affected in elderly. So in elderly patients, it is usually recommended that the anticholinergic medication should not be given for a longer duration.
Okay. So, doctor, since we understand this is a condition in males, especially with the elderlies, as caregivers at home, what is the support that we can give to our OAB members in the family?
Understanding the condition, that it's not something that only he or she is having, anyone can have this condition. You should be compassionate to the patient. This is very important because it's basically a lifetime it's lifestyle thing. The quality of life of the patient is very poor in these conditions, because uh, we can imagine if a person has to run to the toilet every half an hour, 15 minutes. It's very important for him to be socially active. It's very important for him to be otherwise in a well state of mind. And even
Yeah.
in those conditions where the patient is having nocturia, means he has to wake up at night multiple times, so he will not be having good sleep. So the next day he'll be all cranky and something. So you should be understanding these things, and you should be just compassionate about these things, and you should support and understand the condition of the patient.
Really. So this condition can really affect anyone. So let's, as caregivers, at least be with our family members or anyone whom we know is going through this condition. And I believe, doctor, this can be treated, right? It is not going to be there with a person for life. There are
Yes, yes.
cases that
There
can
are
be treated.
medications. These are very effective medications. It's very easily controlled, and once the
Yeah.
factor that is producing these things, it's controlled. You make the lifestyle changes. You just limit the fluid intake, not taking otherwise any unusual meals at night, stopping smoking, weight reduction. These all add up, and the otherwise quality of life is better.
Okay, that's great to know. So I think as caregivers or as family members, I can only urge my viewers to be there with their family members. It's not a disease, so let's not just stay away from it. Let's sit together and treat it. There's any issue that a person's facing, there are always doctors, urologists whom you should be connecting with, especially with a bladder issue that you're facing. Let's not ignore such instances if you're facing any. Do reach out to your urologists and doctors nearby and get the right care and medications you need. With that, doctor, I'd
Yes,
really like
definitely.
to
Very good.
thank
Thank you.
you, Dr. Ankur, for your valuable time. And I think the insights that you shared were very easily understood by most of our viewers, I'm sure, and which is why we got questions very relative to it. So I really thank you for your time and for sharing so much of information on OAB. And I really like to thank all my
Thank you. Thanks
viewers
for
as
inviting
well.
me.
Thank you, Doctor. And thank you, all the viewers, for
Thank you. Thanks
sharing
for inviting
the
me.
questions. Hope we were able to answer all of it that you were looking at. And with that, it's a wrap. Thank you very much. And stay tuned for more on this page. We're here with Bladder Wellness, and we're also available on YouTube, Twitter, and Instagram. Thank you, everyone. Have a great day.